Hello and welcome from all of us at Equus Magazine and equisearch.com. I'm Kate Light, Content Manager for equisearch, and I'm so glad that all of you could join us this evening. Before we begin, I'd like to say a big thank you to our sponsor, US Rider, the premier roadside assistance plan for equestrians, for making tonight's presentation possible. We're lucky to be here tonight with Dr. Don Walsh, a laminitis specialist and winner of the Mariel Lifetime Achievement Award, which is presented to a veterinarian who has dedicated his career to treating horses with laminitis. Dr. Walsh is also the founder of the Animal Health Foundation, an organization dedicated to preventing laminitis by funding research and providing education for horse owners just like you. Dr. Walsh has a wonderful presentation that will be followed by a live Q&A. Please feel free to type your questions to us throughout the webinar, and we'll get to as many as we can tonight. Dr. Walsh, I'll turn the floor over to you.
Okay, well, thank you, Kate. And also thanks to Equus Magazine and equisearch for hosting the Laminitis webinar. Welcome to everyone tonight that's attending, and I want to commend you for taking the time to learn more about this important disease. I hope that you'll find this information helpful to you and to your horse. When I first start these presentations and I'm talking with horse owners, I'm not advancing, Kate. Okay, there we go. I like to let them know that I'm speaking to them not only as a veterinarian, but also as a horse owner. This is a picture of myself when I was a young boy, my first horse show, actually. And I've enjoyed all kinds of equestrian activities throughout my career and have enjoyed all of it very much. And I presently do ride and drive both. And so I wanted to let you know that I am, as people say, horsey. When I was a young boy, now for some reason, Kate, I'm not advancing when I advance. Okay. When I was a young boy, I was given a book called The Modern Horse Doctor. It was almost a century old at the time, and very old antique book, and it had this wonderful picture in it that I used to look at, and I wondered, you know, just how could a horse look this way? How could a disease make an animal look this uncomfortable? Well, as I found out, when I got into private practice, and here's a horse with laminitis, they do look this uncomfortable. This is the most painful disease that a horse has to endure. Here you see a horse that was normal 48 hours earlier, and now she can barely walk. Laminitis kills many horses each year in this country, but unfortunately the disease doesn't kill the horse. The owner and the veterinarian have to make that decision to euthanize the horse, and this can often be a heart-wrenching decision for an owner to have to make. I think you're going to have to advance, Kate. I'm not getting that done.
Dr. Walsh, try moving your mouse and see if that helps.
Okay. For some reason, the keyboard is not advancing it. I can move the mouse, but I can't advance.
Okay, well, if you can just say next.
I'll just tell you next, yeah.
Okay, thank you. Sorry, folks.
Well, this is what laminitis is all about. These are two pictures. The hoof that's displayed on the upper left is the normal horse's hoof. It's been cut in two right down the middle so that you can see the internal structures. And the hoof on the lower right is one that suffered severe laminitis. And if we look at the picture on the left, we can see that the distal phalanx, or the coffin bone, is located in this proximity to the front of the hoof wall. The lamina here are connected to the dorsal hoof wall, and they hold this bone in place. So it's actually suspended just above the sole of the foot. And in the picture on the right, when severe laminitis occurs, this junction here with the lamina is destroyed, and this allows the bone to rotate and also descend, and you can see that the sole is protruding downward in this slide. So what we basically have is a failure of the lamina to hold the bone in place. So this junction between the bone and the external hoof wall is what is ruined when horses have Laminitis Founder complex. We use these two terms. Oftentimes Founder refers to the fact that the bone has descended or gone down. Next, please. If we look at a slide that depicts the internal surface of the hoof wall, here down at the bottom is the sole of the foot, and these are the primary lamina that are running all the way from the coronary band down to the bottom of the hoof. The hoof wall has been cut away here so you can get an idea of how these lamina are positioned. There are actually 600 of these, and they're located all the way around the inside of the hoof wall, from heel to heel. And it's this junction with the external hoof wall and now the bone that we're going to look at to understand what's going wrong when horses develop the disease. Next, please. This is a schematic diagram in which a piece of hoof wall now has been removed from the hoof, and this is the bone, and it's now attached to the external hoof wall. And these are the lamina that we looked at, those sheets of lamina, but now interdigitating with them is live tissue, and this is the dermal tissue that's attached to this connective tissue in the bone. So this is the junction here that we want to look at, and I'll explain exactly what's going on when laminitis occurs. Next. This is a fresh specimen that shows exactly the same picture we just looked at. The hoof wall is over here on the left, and these are the lamina that we looked at, all 600 of them lining up. Here's the bone over here, and this is the dermal tissue, which is now interdigitating in between these lamina. So this affects an increased surface area for the attachment of this tissue to the lamina so that it strengthens the attachment to the bone. Next. If we look at a video of the lamina, you can see that these structures are not rigid, they're very flexible. And you can see how when a horse moves, these things actually will stretch a little bit and give, so that when the horse's foot strikes the ground, the lamina acts sort of as a shock-absorbing piece of tissue to allow the bone to move very slightly, but not much. When we look under higher magnification at this, we can start to appreciate that there are secondary lamina that are coming off of this primary lamina. And when we pull this piece of tissue hard enough to pull it apart, we see that the lamina over here on the left remain attached, even though this tissue is going to pull apart at the junction of the dermis and the bone here. So this is to demonstrate how strong this bond is normally in the horse's foot. Next. Now we're looking at a microscopic view of one of these single 600 lamina right here. And when we put it under higher magnification, you begin to see that there are many finger-like projections coming off over and over. And these are the secondary lamina. And this is actually where the attachment to the hoof wall takes place. There's a basement membrane that runs completely around here, and these epithelial cells that you can barely see here, we'll show them in higher magnification, they sit on top of this basement membrane. And this has to all stay together in this beautiful uniform arrangement for the strength of the hoof to remain normal. Next. If we look at this diagram, you can begin to see this blue basement membrane. It goes all the way around every one of these secondary lamina. And attached to the basement membrane are these cells. These are very important cells, and they provide actually the growth that provides the keratin that makes the lamina. They also play an important function when the hoof is growing, because this red line here depicts the basement membrane over on the right, and these little attachments called hemodesmosomes transfer information into the cell. For instance, it tells the cell once it's formed at the top of the foot to no longer multiply. It's supposed to slide down as the hoof grows, these hemidesmosomes disattaching and reattaching. The hemidesmosomes do this by a process of utilizing an enzyme that's present in them called a protease enzyme. And when it's activated, it dissolves this attachment, allowing the cells to move along the basement membrane. When laminitis occurs in one form of the disease, these protease enzymes are all activated at once, and that produces an enormous breakdown within this basement membrane and allows the bone to change positions. Next. So here we're going to look at this mare again, and something has gone wrong inside of her, something like diarrhea or Potomac horse fever, some other disease, a retained placenta, and it has produced inflammatory mediators which wind up reaching the foot. And when they reach the foot, they activate those protease enzymes that are present within those little hemidesmosomes, and when they're all activated at once, the entire basement membrane will start to slip away from those cells. And as it does, the lamina then will start to separate. And you can see now that those are activated, it easily separates the lamina, allowing the bone to descend into the sole of the foot, producing this very, very painful condition for the horse. Next. If we look at the slide over here on the right, this is one of those 600 lamina that we looked at, and the secondary lamina, everything is normal. This is what it looks like when a horse has severe laminitis like we showed in that picture. The basement membrane now is shredded, and it no longer is attached to any of the cells. That's why it's so important when horses develop laminitis to immediately try and intervene and try and stop this process as quickly as we can, so that the damage can be minimized. Next. This is a picture of a waterfall in Australia, and when I saw this picture, it reminded me of how I envision laminitis presently. I've told you about this form of laminitis that we just talked about, the enzyme-activated form, and it is one of the main pathways that produces laminitis, sort of like the waterfall on the left. But the rest of the presentation, we're going to be talking about another pathway that leads to laminitis, a pathway which we've discovered in the last 5 to 7 years. And this pathway is created by abnormalities within the hormone system, and often now referred to as insulin laminitis. It's so important, if you do have a horse with this disease, that you know which one of these pathways you're dealing with, because the treatment will vary greatly, and it's very important to know that. Next. Well, we talked about insulin laminitis. It's also called endocrinopathic laminitis, which is a word that means endocrine is hormone and pathic refers to abnormal, so abnormal hormones. And insulin is a hormone. It's produced in the horse's pancreas and released into the bloodstream and goes to target organs. That's the definition of a hormone. It's got to get into the bloodstream to go to where its effect is. Anyway, there are 2 diseases where we see high levels of insulin within the horse. One disease is equine Cushing's disease, and the other disease is equine metabolic syndrome. The horse on the left, pictured here, has equine metabolic syndrome. It's characterized by horses that are oftentimes referred to as good doers or easy keepers, but the thing that we notice most readily about this horse is that it tends to have this large crested neck. This is an area where fat is deposited. They also have large fat deposits behind their withers and oftentimes on the tops of their rumps, so much so that they have a little trough down their back that water sits in. And these horses oftentimes have enlarged prepuces as well, and they are oftentimes running high levels of insulin all of the time, and that's how we will eventually diagnose these horses and check it. Next. This horse has equine Cushing's disease, And this disease is caused by an abnormality that occurs in the horse's pituitary gland, located right beneath his brain. The gland produces an abnormal hormone, and that hormone causes higher levels of insulin to occur within the animal's system. It's oftentimes characterized by abnormalities within their hair coat. This is summertime, and this horse hasn't shed his hair out, and he's sweating, he has a long hair coat, and it's abnormal for this time of year. So this disease is treated differently than equine metabolic syndrome. It's actually treated with a drug that reduces the hormone that's produced abnormally in the brain. We use a drug called pergolide to treat these horses. Next. Well, what is insulin resistance? We say when horses have very high levels of insulin within their system that they are insulin resistant. What does this mean? If we look at a normal horse over here on the left, and what happens, his insulin is produced and it comes to the site on a cell where there's an insulin receptor. It locks into the receptor, and that opens the gate and allows glucose to go from the bloodstream into the cell. When we have horses with insulin resistance, the insulin comes to the insulin receptor, and the receptor does not accept it. It doesn't work, and glucose is blocked from going into the cell. This results in higher levels of blood glucose being produced in the animal's body. In people, this will result in type 2 diabetes because the glucose levels go higher and higher. But in the horse metabolizes this excess glucose in his bloodstream into fat, and he lays it down in these fat deposits that we've shown you in the horses that have the insulin resistance going on. Next. Well, this is a picture of a typical spring day in the Midwest part of the United States. The leaves on the trees haven't come out yet, but the grass is growing very rapidly. It's very warm in the daytimes. It's in the 70s, and the grass produces very high levels of sugars and carbohydrates in the grass. And in the nighttime, the temperature is very cool, and the plant metabolism slows down, and it delays any of the metabolism of the carbohydrates in the plant. So in the morning, the plant starts out with higher levels, and day by day, these plants have very high levels at that time of year of carbohydrates within them. If horses with insulin resistance go out and eat this grass, it raises their insulin levels even higher, and they develop laminitis from eating it. And that's the method that we feel is going on. Although no one has completely reduplicated this cycle yet, these are the horses that go out and eat this grass, the ones that have insulin resistance, which develop laminitis. Next. Obesity is on the increase in this country, and we see many more horses that are overweight. And being overweight is a prelude to insulin resistance. When horses gain weight, their insulin resistance gets worse. When they lose weight, it gets better. So as horses increase their weight, they can tend to become more insulin resistant. This horse developed grass laminitis, and when I told its owner that it was overweight, she seemed to be shocked. She didn't think that this horse was overweight. And that's one of our problems. Our perception of what's normal in this country is sort of out of whack. These horses are overweight. We see so many horses that look like this that pretty soon everybody thinks they're normal, but they're not. They're overweight, and this is a really high risk factor to develop insulin resistance. Next. Well, here's two horses, and they're both very overweight. The horse on the left is a quarter horse, and he weighs 1,370 pounds, but his insulin level is normal. And as you note, when you're looking at his appearance, his neck is flat. There's no crested neck here. So just being fat will not make you necessarily develop insulin resistance. Whereas the horse on the right has equine metabolic syndrome, and when he gains weight, his insulin levels start to go higher and higher. And when he eats any kind of a carbohydrate meal, his insulin level goes up and stays up much longer than this horse over here. So this horse on the left, although he's very overweight and fat, can go out and eat all the grass he wants, and that's actually how he got to look like this, and nothing happens to his feet. Whereas the horse on the right, because he suffers from high levels of insulin, when he goes out, his insulin level will get even higher, and he will develop laminitis. Next. Well, insulin resistance is a dynamic state. It doesn't stay in one place. And it's important for you to know that if horses lose weight, if they exercise, if they take thyroid medicine, their insulin resistance will go down. If, on the other hand, they don't exercise, they get heavier and gain weight, their insulin resistance will go up. So there's many things that affect the level of insulin resistance, and all of us have a varying state of insulin resistance within our bodies. Next. When we have horses that have high levels of insulin and they have these cresty necks, we caution owners and we want them to pay very close attention to how firm this is. Katie Watts came up with this term, the neckometer, and I like it. It means that if the neck's getting very hard and rigid and firm, the animal is very close to developing laminitis. If the neck is soft and pliable, probably the insulin level is not nearly as high as if it were hard. So, but this can change within a matter of days. So it's something you can watch, but you must pay close attention to it. Next. There are other things that we're going to look at, though, that will tell you that a horse has abnormal levels of insulin within his system. And horses that have this will have abnormal growth rings on their hoof walls. Here you see the growth ring is wider at the heel and narrows at the front. Horses that have high levels of insulin have abnormal growth patterns going on within their feet, and I'll show you how and why that's occurring. But one of the first things we notice is that they form these rings on their foot, and that oftentimes the ring is wider at the heel than at the toe. Next. What we really need to do is look at the bottom of their foot. And when the farrier is working on your horse or your hoof trimmer, you need to pay very close attention to this area in the front of the foot here. This is abnormal, what's going on here. The hoof wall should be right back here, and this is stretched laminar tissue. It forms a striation, often referred to as seedy toe. But what's truly abnormal in this picture is that there's blood in this horse's foot. Blood does not belong anywhere in this horse's foot. And you can see that these are small hemorrhages which have occurred. This is the earliest sign that horses have high levels of insulin going on, which are affecting their feet, affecting the changes in their feet. Next. When we look at the histology, the microscopic appearance of a horse that's having high levels of insulin, it's different than when those protease enzymes are activated. Here again is the normal up here on the left. One of those 600 primary epidermal lamina and the secondary coming off. And here it is here in this picture, and you can see that all of the secondary lamina are very disorganized. But what's unique in this kind of laminitis is the basement membrane, this red tissue, is actually thickened and much wider than it would normally be. And the other thing that's going on, these cells that I told you never multiply, are multiplying at a very rapid rate. Next slide. If we look at this under higher power, you can see this is a cell that's dividing. He's chopping himself in two. There are many other cells that are in the state of dividing. So what's happening is that insulin is stimulating a growth to go on within the laminar cells that's abnormal. When this growth occurs, it starts to stretch the lamina and weaken them, makes them more susceptible to any kind of a foot injury. Next. Well, how do we tell if a horse has equine metabolic syndrome or equine Cushing's disease? I hate text slides, but I had to do this to you. And I wish that you would write these 4 tests down, because they should be done if you're going to diagnose these 2 diseases properly. One is ACTH. It stands for adrenocorticotrophin hormone. You just have to write ACTH. We need a fasting insulin. The horse should be fasted with no food for 3 to 4 hours prior to the blood sample being taken. We usually prefer to do this first thing in the morning, but if we can't do that, if you can fast them for 3 to 4 hours, that should be sufficient. We need a blood glucose and a thyroid test. Next. When we look at the outcome of these tests, if a horse has equine metabolic syndrome, the ACTH test will be normal, but the insulin test will be high. If, on the other hand, the horse has equine Cushing's disease, the ACTH test will be high and the insulin will be high. If your horse is normal, both of these tests should be within the normal range. Again, it's very important to know which one of these diseases you're dealing with, especially since Cushing's disease is treated with a different drug that will quickly normalize the ACTH level. Next. I want to show you this pony we were asked to look at. This is a pony we went out to tranquilize because the farrier was having trouble trimming him because he's sort of a not very well trained pony, we'll say. Next. So once we got out there, the owner had noticed that the horse had abnormal rings on his feet that she hadn't seen before. So she was doing her job properly, and it paid off for her. Next. Because when we look at the bottom of this foot, we can see that there's an enormous amount of stretching going on in the lamina in this foot. All of this tissue is abnormal in this area. Next slide. If we look closer at this tissue, you'll see that there are areas that have had hemorrhage or bleeding has occurred. This is old serum over in this area. And this blood is totally abnormal. You should never see this in a horse's foot. And it's coming from up above where those lamina that we showed you are stretching, they're multiplying, they're under the influence of high levels of insulin. Next. This is a normal radiograph. We put a metal marker on the front of the foot so that we can accurately take a measurement from the front of the foot to the front of the dorsal phalanx. This measurement from here to here should remain parallel up and down the whole foot. So this is quite normal looking right here. Next. These are radiographs that we took of the pony the day that I took those pictures. And you can see that his foot is very abnormal. The stretching that's occurred within the lamina has changed the position of the distal phalanx in his foot. And if I sent this radiograph to a veterinarian, they all would tell me that this horse has laminitis and he's actually foundering at this point. Yet nobody told the pony this. On the right is a picture after we treated him with diet, exercise, and thyroid medicine for 6 months. So the tissue has regrown in more of a normal state. Now, it's not totally normal, but it's so much improvement. It shows that if you normalize the insulin level, their feet will improve dramatically. Next. I wanted to show you a picture of the external hoof wall. This is how we started. And now you see, over the 6-month period, he's grown out. He doesn't have those growth rings anymore. They've all disappeared. They're down here. They're not quite grown out yet, but another trim and another 8 weeks and he will have grown his foot completely out. And this looks totally normal now. Next. This is a video of him. I wanted to show this because this video was taken the day that I did those very first x-rays of it. So he's in the back here. He's got his halter and lead rope on, and he's trotting quite soundly in this video. Our videos aren't running very well, but there's the woman. She's an elderly woman that's had horses for quite a while, and her observing this abnormality within the pony's foot saved him from having a severe bout of laminitis. That's what I want you guys to do. Next. So how do we lower insulin levels? We talked about weight loss and an exercise program. We need to feed them a forage diet. These horses that have high insulins can't go out on grass. They have to stay off of it. So we have to make sure that whatever we're feeding them is actually not high in carbohydrates. Oftentimes giving them thyroid medicine will help with the weight loss that's going to get them to lose some weight. It also has been shown that thyroid medication does improve insulin resistance in horses. Horses are often given magnesium and chromium supplements. The question mark is because no science is behind this, but many people feel like they do help. Metformin is a new drug that we're in the midst of trying to figure out if it's going to be helpful or not, and the jury's still out on that. So this is a little chief. Note that his mane's on the left side of his neck here. Here he is in a video, and this day when I Kate, you're going to have to start that, I think. I don't have a hand either. Anyway, you can see he's severely laminitic this day. He's barely able to walk. And she didn't ask me to really look at him. I just noticed him. I was there to see another horse. She said, I know what's wrong with him. He's foundered. He's been out on the grass. And I explained to her that possibly high levels of insulin were behind this. And she sort of understood this because she had a mother who had type 2 diabetes. And so she knew that her mother had to walk to the mailbox every day or her insulin levels would start to go up. So when I explained this all to her, she was very cooperative. Let's go to the next slide. And so 6 months later, I'll show him to you here. You're going to have to start these. Anyway, here he is, and now he's really completely sound. And he's lost an enormous amount of weight. What I wanted to point out to you is so fat in the first video, his mane's on the opposite side, and now his mane is on the other side. He's lost so much of his cresty neck. So he's totally sound now, and you get some appreciation of how much weight he has lost. And of course, the owner is very pleased that he's doing so well. Next. When we have horses that can't eat this grass, they have to be locked off of it. And we put them in dry lots, but it's a very boring life, and I think they need to have some company. But I can tell you that if all you do is lock them up in a dry lot, their feet will continue to get worse, because the only way to get the insulin level down is to include exercise in the program. Next. And the way I do this, or I encourage people to do this, is to build a round pen, because nobody has time to ride their horse every day. But instead of feeding these horses, make them lunge or trot for 10 minutes. They don't need to eat, they need to exercise. So 10 minutes a day is all I ask people to give me with these horses, to make them at a brisk trot for 10 minutes. And what this does, it causes their muscles to demand glucose. It increases the number of insulin receptors on their muscles, and it lowers the insulin level within their system. And then they start to lose weight as well. Next. Putting a muzzle on a horse can reduce their consumption on the pasture by 75%. And this is a good way to manage horses and allow them to still move around and get exercise. If a horse has insulin resistance, I would not recommend that you put a muzzle on him and put him out in the spring grass. But after the grass gets safer, in the middle of summer, these horses can go out and eat this grass without any real danger, especially if they're wearing a muzzle, and the exercise is good for them. A lot of horses don't tolerate these very well, and they spend a lot of time trying to get them off. I think it's important that you teach them how to use it by putting it on them and take them to a mowed lawn so that they can put their face down in a mowed lawn, and that grass will push up through the hole and they'll get the idea. Next. If you have a horse that is at high risk of having dietary problems, you need to monitor the hay that you're feeding him. And the best way is to take a hay core sample and to have this checked at Dairy One or Equine Analytical. There's a lot of information on Katie Watts's safergrass.org website. But the thing you need to write down and remember is when you have the analysis done, the non-structural carbohydrate, that's what you're interested in, is equal to the water-soluble carbohydrate and the starch added together. And ideally, this hay would have less than 10%. Normal hays run about 12 to 12.5%. But if, for instance, you found a hay that was anywhere from 15 to 25%, it would be as bad as putting them out on spring grass, and you wouldn't want to do that. Next. If you can't get your hay tested, you can soak your hay. And you can put your hay in some sort. This is a nice hay feeder to use. And it allows you to soak the hay in a wheelbarrow or some kind of water container and then pull it out. After you soak the hay for 30 to 60 minutes, it will reduce the carbohydrate level by up to 30%. This feeder also reduces the way they take hay in easily. So it will increase the time it takes them to eat it. Next. Horses, as they get aged, are at increased risk of developing Cushing's disease. And what I want you to know is that many horses that have equine metabolic syndrome go on to develop Cushing's disease. And it's why we need to monitor them on an annual basis, because sometimes when we check their insulin level every year, lo and behold, their ACTH level will be higher, and they will now have developed Cushing's disease as well. Many older horses are developing Cushing's disease. I think it's not because, I'm not sure if it's because we're looking for the disease more or whether or not we have a higher incidence of the disease. But it's important to remember that this disease does strike older horses and to monitor them. Next. If you're unlucky enough to have a horse that develops laminitis, I wanted to show this slide. This is a horse in an ice box. This is an ice water slurry, and he's up to his hocks and his knees in this ice water. This is the best way to stop laminitis. In fact, it is the only known treatment that does stop laminitis. No drugs do, only icing. So it's important, if you do have a horse with laminitis, to immediately start icing them. And any way you can do this is using buckets, using soaking boots, whatever. This was a good method this veterinarian had. This horse had eaten 60 pounds of barley and came in and was put in the ice box, and 72 hours later he walked out without any signs of laminitis. Worked great. Next. Well, these are the take-home points that I'd like you to remember. Overweight, crusty-necked horses are at risk to develop grass laminitis. That's a typical picture of one. Next. Checking your horse's feet carefully can reveal early changes that are associated with elevations in insulin within their bloodstream. Remember about the abnormalities on the external hoof wall, but be sure and look at the bottom of the feet. And remember, if you see any blood there and stretching, that's abnormal. You need to have them checked. Next. Exercise is critical to your horse's health. This is a picture of me and my horse. We're both easy keepers. We both fight this constantly. So I'm on your side. I know how difficult this is. But literally, I'm telling you, 10 to 15 minutes of exercise for him a day will make a great deal of difference. Next. Hormone testing is the only way to be sure your horse is not at risk from eating spring grass. Knowing what the insulin level is in the horse is very important. Now, if you have a horse and it's not overweight, it doesn't have a crusty neck, it doesn't have any rings on its feet, it doesn't have any separation in the front of its foot, then this horse probably has no risk of developing laminitis if it goes out and eats grass. And I'm worried that we've scared horse people so badly now about grass, and grass is one of the joys for horses. So if those things don't exist in the horse, he can safely eat grass. Next. I wanted to talk to you just a little bit. You know, the Animal Health Foundation has been funding research for the last 27 years now. And a lot of what I told you tonight is a result of that research. So I wanted to tell you about a few projects that we would like to fund and that we've had requests for, and discuss them to show you where the research could lead us. Next, please. I showed you this picture that we're about to see earlier about these two horses. And we would like to fund a project that studies why the gastrointestinal response to glucose is so different in these two horses. Again, the horse on the left can eat anything he wants, and the horse on the right, if he ingests small amounts of sugar, has a very large response. So we would like to look at this more. We're already doing a genetic study at Cornell that we're funding that's looking at this, because possibly someday we might be able to down-regulate the response in the horse on the right so that he responds more like the horse on the left and he can live a more normal lifestyle. Next. I showed you this slide earlier and told you that the effects of insulin on the cells in the lamina are causing this abnormal growth to occur. The people in Australia that did this research are seeking funding to continue the work, to explain different methods that we might be able to intervene here and block the ill effects of the insulin on these cells. So this is a project that we would love to get funded as well. Next. We need a new and a better test to find horses that have insulin resistance. We think we have the test, and the test involves the owner giving the horse a dose of Karo syrup, depending on the weight of the horse. 60 to 90 minutes later, the veterinarian arrives and takes one blood sample and tests the horse for insulin and blood glucose. And from this, we can spot the horses that are having an abnormal response to carbohydrates and are suffering from insulin resistance. The problem is we have not validated this test. It needs to be run on a large number of horses. The horses need to be done in over and over. There needs to be 3 sets of everything done so that we can compare the results and make sure the test is accurate and make sure it's repeatable. So before I can tell you that this is a good test, this is the kind of research that has to be funded and has to be done. Next. Well, these are all projects that I told you that would help us to greatly understand more about laminitis. And if we finally do enough adequate research, we will remove this fog that we see that these horses are standing in. And the picture will become crystal clear, and we'll know how to take care of these horses and prevent this disease. At our website, we put some more video up in the last month for horse owners to try and educate them more, and I hope that you would view these videos. It takes about 36 minutes. It'll be well worth your time because it's knowledge that might actually save your horse's life. So I hope you go there after the webinar or on some subsequent date. And I think we're ready here, Kate, for the next slide, and this is the end, and we'll take some questions.
Yep. Well, thank you so much for that presentation, Dr. Walsh. We'll move on to the Q&A portion now. And your first question is, if a horse has had laminitis before, is he at a greater risk of getting laminitis again?
Well, my first question always is to people when they tell me that, what caused his laminitis? And this is the question that has to be asked because I showed you the picture of the waterfall, and we have to know which of those 2 pathways are involved. And it's a difficult question to answer without knowing that. If the horse is suffering from insulin problems, and if the insulin levels are not corrected, the horse will be very prone to develop laminitis again. If, on the other hand, this was from some disease entity that resulted in him developing laminitis and activating his enzyme pathway, he may not be more prone to develop that. It may have weakened his foot in some manners, and he may be more susceptible to trauma and other things and bruising, but it not necessarily to develop laminitis again. But again, I point to the importance of knowing which of those 2 pathways you're actually dealing with.
Okay, so here's the next question. Are there any breeds that are more susceptible to laminitis, or do certain breeds have characteristics that make them more susceptible?
Well, I think, again, when we're going to talk about the 2 different pathways, but generally speaking, all breeds, we see laminitis in all breeds. There are some breeds, like the thoroughbred, that seems to have less problems with insulin resistance. There are breeds that seem to have a greater affinity to develop problems with insulin resistance, and they're usually pony breeds. And also some breeds that have but almost all breeds will have some degree of laminitis show up within them. I think as far as the enzyme-activated form of the disease we talked about, there is no breed that is immune to that form of the disease as well. The insulin form of the disease, though, it's definitely seen more frequently in pony breeds and in certain breeds like Pasafinos. It's seen in a high incidence in also in some other breeds. I'm not sure what's happening here, Kate. Getting a big noise in the background. Okay, I think it ended.
I'm not sure what that is, but hopefully.
So I think that there is no breed that really is not affected by that.
Okay. Are there any affordable feeds that you would recommend for Cushing's or insulin-resistant horses, or anything an owner should look for when choosing a feed for their horse?
Well, first of all, if your horse has insulin resistance, you want to limit the carbohydrates. Now, if the horse is overweight, he doesn't need to eat any grain. I mean, he should only eat hay, and again, we want to make sure that that hay has been checked and that it is safe and that the non-structural carbohydrate level is very low. If a horse has Cushing's disease, oftentimes these horses do need to take in more calories because they're not overweight. They're actually, some of them, very thin. But I still try and put most of the calories in these horses through the roughage they eat. There are some specific diets that are designed, though, now, and which try and be very low in starch, which you can feed these horses if they need more caloric intake than what the forage is able to give them. Sometimes people also feed these horses things like beet pulp too, to try and increase the amount of protein that they're getting in them. But in general, I try and, for the most part, with horses with insulin resistance, avoid any kind of concentrate feeds because they're usually very high in carbohydrates compared to forage.
Okay. One person asks, they say, I'm worried my horse will be upset if I use a grazing muzzle on him. Do you think he minds, and does he have to wear it all the time?
That's a good question because I do think it upsets a lot of horses to be in grazing muzzles, and that's why I stress how important it is to put it on them and put them someplace where you know this is going to work, like on the front lawn, where they can actually learn how to use it before they get frustrated. And then maybe only put it on for short amounts of time at first. And then, but when they're outside where they can eat forage and stuff, then they do definitely need to be wearing this at all times, because you need to make sure that you're limiting the intake of the grass to them.
Okay. One person asks, is icing effective for treating endocrine laminitis?
Well, that's a good question, and now we're getting into the science that we know about icing and the work that has mainly been done by Pollitt and Andrew Van Epp. Basically, the only thing that they've been able to show us definitely is that icing will stop the enzyme-activated form of the disease. They have scheduled some tests, I believe, to try and see whether or not icing is beneficial to horses with the insulin form of the disease. But what we have found when we've looked at the insulin form of the disease is that the enzymes that normally are in the active state in the tissue from horses that have the other form of laminitis, we do not see those enzymes as being activated. So we're questioning if icing is really causing the enzymes to be quieted down and not allowing them to be activated, then is this really happening when we're icing horses with insulin? We don't know. The other thing, though, is that we do know that there's an inflammatory response within the foot, and we do seem to think that when we ice these horses, they seem to feel better once their feet are in the ice and they're kind of numbed up. So I think in any case, icing probably is good to do for the inflammation. But whether or not we're blocking laminitis with icing on horses with the insulin form of the disease is still really unknown.
Okay. One person wants to know if there's any correlation between high amounts of carbs, polysaccharide disease, and laminitis.
Well, the question is there any connection between, repeat that, please?
If there's any connection between high amounts of carbohydrates, polysaccharide disease, and laminitis.
Well, I don't, the high amounts of carbohydrates, of course, will elicit laminitis in the horses that have insulin resistance. The polysaccharide disease doesn't seem to be related to laminitis, as far as my experience anyway.
Okay. Does location or temperature affect laminitis? So geographical location.
Yeah. You know, it's interesting that once horses have had laminitis and many bouts of laminitis, then it seems that things can set them off. But, you know, it's almost like they've developed a disease in and of themselves because they've had so much damage to their feet. And cold weather, very cold weather, seems to set these horses off. And also extremes in heat will seem to set them off, where nothing else has changed except they've gone through 4 or 5 days of very high temperatures or gone through a week of very cold temperatures. And when that occurs, oftentimes, not during the period that their temperatures are fluctuating, but a few days after that, they'll actually develop a bout of laminitis. And so I do think that temperature plays a role. And I think, of course, where you live will determine a lot about what kind of grass you have and whether you're prone to have these grasses that have very high levels of carbohydrates in them. Unfortunately, there's not a really good epidemiology study to let us know if the incidence has a much higher disease, for instance, in the Midwest than it does someplace else. And we're trying to work on that. And of course, that requires more research to be done into the prevalence of the disease in different locations.
Okay. Do you recommend x-rays after a bout of laminitis?
I think it's very important on the day that I see the horse, the day one, that he have a set of x-rays. And here's why. You want to have a baseline set of radiographs that you can compare to. And it's important to put that marker on the front of the hoof wall so that you can see exactly what's going on as a reference point to the top of the foot to take all these measurements. So getting x-rays on the first day is very important. Oftentimes x-rays on the first day are very surprising, just like the x-ray on that pony's foot. I mean, everybody was shocked at what that looked like. Well, many times when we see horses that have grass laminitis and it's day one and they've never had laminitis before and this is the first time they've ever had it, there is considerable change on the x-rays that we see on day one of the disease, meaning that their foot has been weakened over a considerable amount of time by the abnormal insulin levels going on. So I think it's very important to find out what the status of the foot is on day one, and then you'll always have something to come back and compare it to. If you wait and take x-rays on day 10 and you go, well, these look pretty bad, I mean, pretty bad according to what? I mean, or pretty good according to what? You need a reference, so you've got to have something that you can compare to at the start. Unfortunately, cases of laminitis often don't occur and give us the best working conditions. They occur at inopportune times, but I oftentimes tell people to make sure that you take the time and you get these cases worked up properly, even if it means that you come back first thing the next morning and radiograph them.
Okay. Is seedy toe always an indication of laminitis?
Oh, that's a good question. I think you can have conditions where you will have seedy toe and the horse doesn't necessarily have laminitis, but I'm trying to think, for instance, there's separation in these horses' feet with white line disease, different things that will produce a seedy toe. I think the real key to that seedy toe is seeing those hemorrhages bleeding into that seedy toe. Because if you see that, you know that this is an active process going on higher in the foot. And it's not just a separation occurring at the bottom of the foot there. But white line disease also produces conditions where you have a large amount of seedy toe present. And of course, white line, if it gets bad enough, can destabilize the distal phalanx enough that they do develop laminitis secondary to it. So it's possible. But I think seedy toe is a very suspicious abnormality seen in horses that have had cases of laminitis and recovered as well, because that tissue never really comes back together. So if your horse had a bout of the form we talked about, the enzyme activated form, and he made a recovery, he might always have some degree of seedy toe present in his foot. And this oftentimes leads to abscesses because the seedy toe allows bacteria into the bottom of the foot, and it can go up and cause abscesses very easily, subsolar abscesses. So I encourage people and farriers, when I talk to farriers, to try and carterize this area to kind of seal the area so that bacteria and dirt can't get up there.
In a horse that's already showing signs of clinical laminitis, is icing still effective?
Well, that's a question that's being answered presently with some research at the University of Queensland at Dr. Pollitt's lab. They're in the midst of looking at horses that have been iced after laminitis started. So we don't have the answer to that yet. But our personal feeling, though, about this is, and a kind of a common sense thing, but is that after laminitis starts, if there is some process that is continuing this, and in other words, if that animal is sick and he's producing these products which are going into his feet and activating enzymes, the process is going to continue on as long as those conditions are in the horse. And so I think icing them should be done, and it should be done until you've removed the cause of the laminitis, or at least determined if the horse is now suffering from insulin laminitis, which doesn't appear to have a large amount of enzyme activation. But I think it is probably useful to ice horses even after they've started having laminitis. Now, I will say at some point, this is an end game, and for instance, if a horse breaks into the grain, I would tell people to ice that horse for 48 hours, 42 to 72 hours. At the end of 48 hours, I'd like to examine his feet, see if he has any digital pulses or anything. But, and then if a horse has diarrhea or something, we would ice their feet until they're over the episode. So that's kind of the way we recommend doing it.
Can miniature donkeys be affected by laminitis?
Yes, they're very prone to develop laminitis, the insulin form of the disease, because they gain weight very easily. They're very efficient animals, and they have a very high incidence. Great Britain has a large population of donkeys. The British people love donkeys, and they keep them in their yards, and many of them are overfed, and they have plagued by laminitis. So yes, they're very prone to do it if they're overfed.
Okay, and I think this will be our last question. What are the ideal times for grazing? Do seasons matter?
Well, I mean, the ideal times, let me just go through what happens. In the spring, of course, the grasses are much higher in carbohydrates and they're producing seed heads. And after the grass goes to seed and it becomes a mature grass, then it slows its growth rate and the carbohydrate levels go down. So safer grass to graze is in the midsummer months. And then as we get into fall, we see these same conditions start to occur, and the grasses start to accumulate higher levels of carbohydrates in them, and they become more dangerous for horses that are prone to insulin resistance to graze on at that time. So I think that, but the time of day, generally speaking, plants build up higher levels of carbohydrates in the afternoon, so that it would probably be safer to let your horses graze these grasses early in the morning. But as I explained with that grass picture, early in the morning in the springtime, these plants are going to have high levels of carbohydrates in them. But more in the summer months, when the plant's doing its regular metabolism, those plants, before they undergo photosynthesis all day long, would have a lower level of carbohydrates in them. The same thing goes for producing hay. Hay that's cut in the morning will have a lower level of carbohydrate than hay that's cut in the afternoon.
Okay, well, that's all the time we have for tonight. We want to say a big thank you to our sponsor, US Rider, for making this webinar possible. Thanks very much to all of you for joining us this evening, and thanks again to Dr. Walsh for his presentation. We'll be putting a video of this webinar up on the website, so you'll receive an email with a link to it in the next few days. Have a good night, everyone.
The organizer has